Untold Physio Stories is part of the all-new PT Podcast Network. Find a new favorite podcast by an amazing PT content creator at ptpodcastnetwork.com. The future of medical documentation is here, and it's revolutionizing the way we record patient visits. Introducing Comprehend PT, the groundbreaking HIPAA-compliant AI scribe designed specifically for physical therapists. Imagine a world where the dialogue between PTs and patients is interpreted by AI into precise, real-time medical notes without lifting a pen or tapping a keyboard. Comprehend PT does just that, allowing healthcare professionals to stay engaged with patients rather than buried in documentation. Boost your efficiency, reduce claim denials, and liberate yourself from the burdens of manual note-taking with Comprehend PT. Join the revolution now at comprehendpt.com. Untold Physio Stories listeners get 50% off their first month with code MMT50, and there's a free trial available. Sign up now. I use it every day in the clinic for virtual and live visits. I just speak to the patient, and at the end, hit Comprehend, and a SOAP note's generated. I love it, and you will too. Welcome to Untold Physio Stories podcast, your perfect commute resource with physio failures, successes, interesting cases, and more from the physio and rehab world, with your hosts, Drs. Andrew Rothschild and Urson Religioso. Welcome back to Untold Physio Stories podcast. I'm one of your hosts, Dr. E, with Modern Manual Therapy, Edge Mobility System, and our 4-month online mentoring program, Modern Rehab Mastery. My co-host, Dr. Andrew Rothschild, is not with me today, but I have a very special guest, Dr. Mohamed. Oh my gosh, I should have asked you how to pronounce your last name, man.
No, you're good. You're good. It's Dr. Almubiadin.
Are you sure?
Yeah. And if you want to hear how it sounds in Arabic, it's even better.
Yeah, sure.
So my full name is Mohamed Almubiadin. That's how you say my full name in Arabic.
Oh, nice.
Yeah.
Well, we should trade. Do you know how to pronounce my last name?
Oh man, let's see. I'm gonna butcher this. Religioso.
Yeah, well, it's pretty close. I don't know why people don't even get the Italian version right. That's religioso.
Hioso. Okay, religioso. Okay, got it. So the G isn't pronounced.
The G's an H. Spanish.
Okay, beautiful. I can get with that.
Right.
Yeah.
So anyway, I was on LinkedIn one day and perusing just the feed, and Mohammed's interesting case came up. Why don't you first give it like a quick summary of where you are, your practice and everything, and then your case.
Yeah, well, where I'm at, I'm currently in Dallas, Texas. And then again, my name is Mohamed Almubiadin. I'm a licensed physical therapist. I'm actually also a student athletic trainer going through a master's of athletic training program here in Arlington, Texas as well. And where I'm currently practicing, it's kind of a tricky question to answer, because I'm currently doing a lot of like contract work, and I work with a lot of professional athletes on the side, but I also do children's home pediatric, but I also do some hospital contracts. So I'm a big Swiss Army knife right now, just kind of help me get by as I'm getting through school. But yeah, so that's a little bit of a quick background. So I went to the University of Mary Hardin Baylor to get my license in physical therapy, and again, and currently in athletic training school for my master's at UT Arlington. So the case that we're going to be talking about today, it's a case that I had about 2 years ago. It was my first year out of practice in an outpatient setting, and I had an individual come in, a very young male, who came in, college student, and was complaining of shoulder pain, scapular pain. And he came to me, and he was really, he felt as if the way he was describing it when we were kind of going over subjective, he felt like his shoulder blade was going to pop out of his socket. And that's just how he was describing it. And so I was confused, and like as I was getting his subjective, I was like, did you have any falls? Did you have any kind of direct trauma? Anything of that nature? Do you play any sports? He's like, I don't play sports. I play recreational basketball sometimes. Haven't had any falls, haven't had any accidents, nothing. Like, I don't know what's happening. I woke up with this thing. And I was like, okay, well, let's go ahead and have you, if you don't mind, take off your shirt, turn around. Let me just take a look at you real quick. And lo and behold, takes off his shirt, and it was like the most significant, severe scapular winging I had ever seen, and it was unilateral too. So that was even more weird. And the fact that he was just saying that he hadn't had anything, like hadn't had any injuries prior, never had any shoulder issues, and just woke up with it. That was just, man, it was beyond me. It was stumping me. So, and I'm a new grad, coming out of PT school, and I'm looking at this, and I'm like, man, I'm stuck. I don't know where to go here. So I relied a lot on my subjective skills, as I've kind of mentioned in that LinkedIn post, but I just kind of kept asking more questions. Have you had any? Are you taking any medications? Do you have any sicknesses or any illnesses that you've been dealing with? And as we're going through everything, no significant past medical history, no significant change, or doesn't take any medication. Again, everything was fine, right? I won't even go into super detail. But he was mentioning, he kind of stopped me at one point and was like, you know what? I do remember 2 weeks before this happened, 2 to 3 weeks, I had mono. And I was like, okay, in the moment, I'm like, okay, like I'll write this down. But I was like, oh, I don't know how this helps me, but I'll just write it down anyways, right? So write down mono. And he's like, yeah, I had a lymph node, like my lymph nodes were like really swollen and just kind of like, jarred up right here in my throat. And, I was kind of going through it for a few days, but I mean, other than that, it was fine. I was like, okay. All right. So after everything's said and done, I was like, all right, well, you obviously have, your typical, you have a serratus anterior weakness. I'm looking at you. It's like, let's see what we can do here. I'll have you come back in. We'll try to strengthen your shoulder blade up. We'll try to strengthen this muscle that I feel like is not working adequately. But let me do a little bit more research and kind of get back to you, and we'll kind of come back. And went and did some research. And I think all I literally typed in was, I went back to my laptop. I said mononucleosis, scapular winging. I think I typed that into Google. And nothing scrolled. And I found like one case study. And this case study was a 15-year-old male from 1996 that had Epstein-Barr virus, which apparently also leads to the diagnosis of mono. It can cause mono, which then causes neuroinflammation and causes a for this specific person, cause a long thoracic nerve palsy, which is the same nerve that innervates the serratus anterior. And I was just like, oh my God, this is the coolest thing ever. It's the most interesting thing I've ever seen. So I was like, okay, well, looking more into this. So I was doing some clinical work for my athletic training program at a high school, and a child comes in with the exact same subjective kind of presentation that my first one that I mentioned came in with. And this kid, again, had gone through all the diagnostic imaging, nothing to do with nerves, but had done, x-rays, CT scans, MRIs, and everything had come up negative, which is to be expected if we're assuming that what I found was correct. Again, I didn't mention this for my first patient, but my first patient also went through all those diagnostic imaging tests as well. Again, all the doctors were stumped. No one really knew what exactly was going on. They just didn't really understand it. And so this kid comes in, same history. The parents are really burnt out with going to the doctors. They don't want to do it anymore. They're over it. And they just, at this point, are just like, let's just do what we can and, see what we can do. And he's seeing a physical therapist and isn't really helping much. Just, again, based off of what we talked about, if we're assuming it's a nerve palsy, then, just strengthening it up isn't really going to do much anyway. So, again, it's just one of those things where, like, I think there's a disconnect in understanding, like, what's happening with this patient. But it's funny because the first thing, it was after I had asked him the basic subjective questions, the very first thing I asked him was, have you had mono? And he goes, actually, yeah, I did have mono. And I was like, well, when did you have it? Was it, how far or how close was it to when this shoulder issue started happening? He was like, man, I think it was like a month before. And I was like, And then my preceptor, the guy that was the person that's with me at the high school, just looked at me like, what a weird question to ask. Why are you asking about mono? And that's when we had that conversation. But anyways, I say all this, and the reason why I decided to share this on LinkedIn, because I was like, oh man, it's happening again. Like, I'm seeing this. Like, what are the chances like this happened twice? And I'm only 3 years
can't be
out.
that much.
You know,
Either
it's
that or it's more common and no one's looking at it because there was only one case report from 1996.
exactly. Well, now there's a few more now. Like there's I went when I was reviewing it with my preceptor. We kind of talked about it. He asked me why I asked that question. I brought up my previous case that happened about a year or two ago, and yeah, we found like 2 or 3 more case studies that were really similar. But it was
What do
just
they
so
do? Like antivirals, or I mean, like what?
so what they did was they all kind of essentially figured out that they might have had Epstein-Barr virus prior to. So the diagnosis, the word we're looking for using right now is called multi. Oh God, I can't remember it now. It's multi. I'll have to go back and check. I'm so sorry, I can't remember this off the top of my head. But there's a word for it. There's a specific word that basically is the cause of that leads to the palsy. But this diagnosis comes from Epstein-Barr, right? Which then leads to mono. So individuals have mono thinking that they just got mono out of the blue. Well, actually, that this ends up happening to. Well, actually, it looks like what might have actually happened was that they got Epstein-Barr, which led to the mono, which led to the palsy, right? Because the Epstein-Barr virus was actually what's causing the neuroinflammation and the nerve palsy, the nerve irritation, and the mono that happens after is just the after the fact. And so I don't know, I just find it really interesting because I think you're right, like you said. I mean, either it's something that just came up. People aren't really looking into it, so maybe that's why it seems so rare. But I don't know. It's just so fascinating to me, and I got
Right.
so intrigued and looked into it. But yeah,
It's probably a question that I mean, that's why I love cases like this, even if it doesn't necessarily tell us what to do with it, but it probably tells us better questions to ask.
yeah. I mean, 100%. And I think that finding that missing piece is so important. But better questions to ask is so important. I'm a really big believer in having a very thorough subjective, and I think they teach us this in school. But we're all like young, and we're like, I just want to do all the special tests. I want to figure
Well,
this out.
it's not even that. I just think that you're a newer grad, right?
You're right.
And you tend to ask better questions than someone who's 26 years out like I would.
Right. Well, I guess that makes sense too. That's a good point because
Because like I ask these
by the book.
questions because we have like experience, right? Experience is
Yeah.
pattern recognition, and I think I can when I don't see patterns, it's almost like, what am I supposed to
Yeah.
ask again?
Yeah. Like what do
Because
I do again? Yeah.
right?
It's
Yeah. But
100%
you
pattern
guys are already
recognition.
like, since you don't have all the pattern recognition yet, you just fall back on the questions that you're asking. I mean, it
Yeah.
is a similar case. If you haven't heard my podcast, just recently someone came on and said that his student found that a patient who was having like low back pain and like these GI issues actually just found out that they were constipated, like severely constipated. And it's like, oh, I wouldn't have asked that, but the
Right.
student asked that, the new grad asked that.
Like the
And it
bowel
seemed,
movements and stuff, like the questions
yeah,
about bowel
yeah,
movements. Oh wow, yeah. See, that's a great. I don't think about those questions either. Yeah,
right.
that's
Well, I
fantastic.
mean, yeah, and he just happened to be like asking questions, and then that just came up. Like, oh yeah, like the patient had severe constipation.
Yeah, yeah. No, it's crazy how that works. But like I said, I'm a big believer in that subjective, that thorough subjective history. Because if you do a really good subjective, you're gonna find out.
You're
You're
gonna
probably
find
gonna
something.
Yeah, you're gonna find something, and you probably won't even have to do like 90% of the tests that you were planning on doing anyways, because you'll
Right.
already have a really good idea of your diagnosis by then. But I bring that up, and like I said in the LinkedIn post, I bring it up as a conversation to have with like the community, as the subjective is so important, but also when you get to those points of like, oh, I don't know what to do, or saying, don't write the patient off, like keep digging, keep looking, keep trying to find something. Don't just kind of like go back to, oh, you know what, we're just gonna strengthen it up and like here, send you off to the floor. Just we'll figure it out later, or we'll do whatever we can. But again, we got to this point with this patient, and I was able to present the case study to him, get some input. Um, we could always push for an EMG, but then at the end of the day, at that point, it was like, what's an EMG gonna tell us? Like the nerve doesn't work. Okay, then what? Like what's the next step after that,
Right.
right? So and the case studies you asked what they did, they did provide, obviously, well, they didn't need to because these guys were presenting after the fact, so there was no like medication actually being
Right.
involved in their treatment, but they actually reverted to strengthening the SA, parascapular muscles, yada yada yada, all the basic stuff that you would already know as a physical therapist. And then what they actually found was 2 years later, these guys weren't doing it for 2 years, but they found that when they would like followed up with their patient by a year or two, they would spontaneously just improve. So nerves regenerate. We know that, and I think that um, me as a student, me being a new grad, but like having that student brain, is like, I want to figure this out. I want to get this done. I want to do this now. Like, how do I fix this now? Go get an EMG study. Go to the doctor. Go do this, and you like try to push for all these countermeasures to get just to make yourself feel better about like, yes, I got it right, or yeah, or whatever the case may be. But we have to remember at the end of the day, what is it that what can we do? Like, okay, yes, let's get to that point. Yes, you're right. What do we do now? And I had that conversation with my preceptor too. It's like, okay, even if this is the case, how do we fix it? If we push for all of this, we push for him to go see a neurologist, we push for him to go get an EMG, we push for all these extra things. What are we going to get out of it? Like, how does he improve? And you kind of have to take a step back and just be like, you know what, you're right. Like, what can we do? So we just like in this moment, all we can do in our scope, and it's kind of we kind of had that conversation with the athletic trainer, and then it also pertains to physical therapists as well. But like, you have that conversation where you're like, I think within our scope, it's really just important for us to understand that we can have those educating moments with the patient, making sure that they understand what's going on to the fullest of our abilities. Hey, this is our suspicions. We think this may be happening. Here's some like research to back it up if you're interested. In our case with this child, we called the parents and explained to them everything as well. In the high school setting, I mean. And then at that point, you just have them get in control of the rehab. What would you like to do? Here's what I can do for you. Here's what you've tried. Let's just kind of go from there. But I think those things are just important to kind of keep in mind.
Awesome. Well, thanks for that. If you have a link to any of the cases or even like pictures, and I think you may have shared pictures on LinkedIn, I could potentially post them along with like the blog version of this podcast. But if you guys have any comments, any listeners or any similar cases, any light bulbs, make sure to comment on anywhere I post this on social media. Thanks again, Mohamed, for coming on the podcast.
Yeah, absolutely. No problem. Thank you for inviting me.
All right. Yeah. Hey guys, thanks as always for listening. If you like this podcast, make sure to give us 5 stars wherever, and hit that subscribe button wherever you listen to podcasts. And as always, you guys have a great day.